The World Health Organization's approval is everything to Ocugen stockholders. In any case, you still may be wondering if Ocugen can maintain these gains, or if the stock price will sink like a stone in the coming days. Here in this video we'll analyze it to help you to make the right decision. Your subscription to our channel means a lot to us and give us the support to continue doing researches. Ocugen Incorporated is a biopharmaceutical company focused on developing gene therapies to cure blindness diseases and developing vaccines for COVID-19. There's a much more important pending decision that really matters for Ocugen Health Canada's review of the company's rolling regulatory submission for COVAXIN. If this decision is favorable, Ocugen investors would have a legitimate reason to celebrate. However, it's uncertain how long it will be before Health Canada completes its review of the company's regulatory filing. Ocugen, small-cap biotech, has already seen its shares go parabolic over the past year. Thanks to a North American co-commercialization deal with India's Bharat Biotech for the COVID-19 vaccine COVAXIN, this tiny biotech has become one of the best-performing stocks in the entire market this year. Since the high point reached in February, the stock has retreated 45%. Investors have worried, and rightly so, about COVAXIN's prospects in the U.S. market. But in recent days, Ocugen shares have begun to pick up speed. They gained more than 22% this past week. Now, some investors might be wondering if Ocugen will hang on to this positive momentum, or whether the stock is heading for a crash. Let's take a closer look. Ocugen's deal with Bharat first. A bit of background about Ocugen's deal with Bharat. Ocugen's core business actually isn't vaccine development for infectious diseases. The company develops gene therapy for eye diseases. Its most advanced candidate is set to enter a phase half trial this year. That means revenue is far off. Enter Bharat Biotech's COVAXIN. Bharat completed phase 3 trials and generated positive data. The next step is regulatory review. Ocugen's agreements with Bharat only covers commercialization in the US and Canada. And of these two markets, the US is the biggest and could represent the most revenue. Now, here are the problems. First, the US already has plenty of vaccine doses right now. The country bought enough Pfizer and Moderna shots to cover almost all Americans. To make matters worse, the U.S. Food and Drug Administration advised Ocugen to take the traditional route and apply for approval instead of Emergency Use Authorization, EUA. The regulator has granted EUAs in a matter of weeks following applications. Traditional approval could take 6 to 10 months. And, finally, Ocugen says it may have to conduct a new clinical trial rather than just use data from Bharat's trials in India. That will slow things down even more. Ocugen's route in Canada may be easier. But Canada has ordered vaccines from at least 8 different companies. So it's difficult to imagine Ocugen gaining significant revenue in a market shared with that many other players. For the 6 months ended 30 June 21, Ocugen revenues decreased from $43,000 to zero. Net loss applicable to common stockholders increased 64% to $33 million. Revenues reflected a decrease in demand for the company's products and services due to unfavorable market conditions. Higher net loss reflects research and development. Balancing increase from $3.1 million to $20.9 million. Expense, selling, a general and administrative increase from $3.9 million to $8.8 million. Expense. Following which stocks Reddit's Wall Street Bets crowd is talking about this year has paid off, as several have gone through epic rallies and seen heightened volatility. OCGN is the second highest trending name on StockTwits and is also in the top 10 on Wall Street Bets Reddit in terms of message volume over the past 24 hours. In recent days, some have cheered about the possibility the World Health Organization will offer COVAXIN authorization. News reports, such as one on NDTV, suggest such authorization may happen soon. But a thumbs up from the WHO won't put revenue in Ocugen's coffers. That's because such an authorization doesn't mean Ocugen can sell COVAXIN in the US and Canada. Regulators in those specific markets make that decision. And it's unlikely they'll feel pressure by a WHO decision to speed up their own processes.